Abyssinian is one of the most popular cat breeds, and they have several health problems that they may face. Here are 6 health problems in Abyssinian cats. 1. Gingivitis. Gingivitis is the initial stage of development of periodontal disease. This occurs when dental plaque builds up along the gum line and causes inflammation of the gums. Gingivitis in Abyssinian cats can be caused by the secretion of acids and toxins released by bacteria in dental plaque. Symptoms of gingivitis include red, swollen and bleeding gums, and bad breath. 2. Periodontal. Periodontal disease is a condition that affects the supporting structures of the teeth, including the gums, jawbone, and periodontal ligament. There are 2 main forms of periodontal disease, namely gingivitis and periodontitis. Gingivitis is the initial stage where the inflammation is limited to the gums. However, if gingivitis is left untreated, the infection can spread to the tooth's bone structure and ligaments, causing periodontitis. Periodontal disease in Abyssinian cats can be caused by accumulated bacterial plaque, tartar, bacterial infections, and genetic factors. Symptoms of periodontal disease in Abyssinian cats include bad breath, bleeding gums when brushing or chewing, difficulty eating, excessive drooling, painful chewing, and tooth loss. Treatment of periodontal disease in Abyssinian cats depends on the severity of the condition. Cleaning tartar and removing bacterial plaque are important steps in treating gingivitis. If there is loss of the tooth's supporting structure, the veterinarian may consider applying antibiotics, root canal treatment, or tooth extraction. It is important to keep Abyssinian cats' teeth and gums clean by brushing their teeth regularly, providing food that supports dental health, and having regular veterinary checkups to prevent and treat periodontal disease. 3. Amyloidosis. Amyloidosis is a serious condition that can affect Abyssinian cats. Amyloidosis in cats refers to a series of conditions in which there is deposition of insoluble amyloid protein in body tissues. Amyloid protein is formed when normal proteins undergo structural changes and form aggregates that cannot be broken down by normal mechanisms in the body. In Abyssinian cats, there is a clear genetic predisposition to amyloidosis. In some cases, amyloidosis in cats is caused by a buildup of amyloid A protein or AL, light chain, amyloid protein that forms in severe inflammatory conditions or certain cancers. Amyloidosis can also occur in certain organs, such as the kidneys or liver. Symptoms of amyloidosis in cats can vary depending on the organs affected. Some common symptoms that can occur include weight loss, anorexia, loss of appetite, fatigue, polyuria, excessive urine production, and polydipsia, excessive thirst, thin and dry hair, dehydration, depression, stomachache, diarrhea, vomiting, and swelling of the affected organs. Unfortunately, there is no treatment that can cure amyloidosis in cats. The treatment carried out aims to reduce symptoms and alleviate the cat's suffering. If amyloidosis affects the kidneys, cats may require medical treatment such as intravenous fluids to maintain stability of the condition. Special diets and certain medications may also be recommended to reduce symptoms. The prognosis for amyloidosis in cats is generally fatal, and amyloid deposition will lead to systemic failure and ultimately death. Therefore, it is important to prevent the breeding of Abyssinian cats that have a genetic predisposition to amyloidosis. 4. Progressive retinal atrophy. Progressive retinal atrophy is an eye condition that can affect Abyssinian cats, as well as several other cat breeds. Progressive retinal atrophy is a general term that refers to a group of eye diseases that cause degeneration and loss of photoreceptor cells in the retina, the light-sensitive layer within the eye. Progressive retinal atrophy in Abyssinian cats usually occurs genetically, with variations in age of onset and severity of symptoms. This condition can affect both eyes on one side, unilateral, or both eyes, bilateral. Progressive retinal atrophy usually begins with mild symptoms, such as decreased vision in dim lighting or at night. Gradually, the cat's vision will become increasingly affected and complete blindness may develop. Symptoms of progressive retinal atrophy in Abyssinian cats include: first, loss of night vision. Cats may have difficulty seeing clearly in dim lighting or at night. Second, impaired pupillary reflex. The cat's pupils may not respond well to changes in lighting. Third, limited vision. Cats may have limited vision or difficulty seeing distant objects. Unfortunately, there is no treatment that can cure progressive retinal atrophy in cats. However, it is important to monitor your cat's vision regularly and provide appropriate care to maintain its quality of life. Some steps that can be taken to help Abyssinian cats with progressive retinal atrophy include: first, safe environment. Make sure the environment around the cat is free from obstacles and objects that could cause accidents. Second, change in routine. Cats with progressive retinal atrophy may need time to adapt to changes in routine and home layout. Third, feeding. Ensure that the cat can reach and access food and water easily. Fourth, regular visits to the veterinarian. A veterinarian can help monitor the progress of progressive retinal atrophy and provide advice on necessary eye care. Although progressive retinal atrophy in Abyssinian cats cannot be treated, with proper care and good support, cats can still live happy and comfortable lives. 5. Hypertrophic cardiomyopathy. Hypertrophic cardiomyopathy is a common heart disease in cats, including Abyssinians. Hypertrophic cardiomyopathy is a condition in which the heart muscle experiences abnormal thickening, which can interfere with the normal function of the heart. In Abyssinian cats, hypertrophic cardiomyopathy is often genetic, meaning it can be passed from parents to offspring. However, environmental and lifestyle factors can also influence the development of this condition. Hypertrophic cardiomyopathy in Abyssinian cats can occur at any age, from early adolescence to adulthood. Symptoms of hypertrophic cardiomyopathy in Abyssinian cats may not be obvious in the early stages. However, over time, cats may experience symptoms such as: first, cough. The cat may have an abnormal or frequent cough. Second, shortness of breath. The cat may have difficulty breathing or pant. Third, tired. The cat may appear tired or not have its usual energy. Fourth, swelling. The cat may have swelling of the abdomen or extremities. Fifth, fainting. In severe cases, the cat may faint or collapse. If you suspect that your Abyssinian is suffering from hypertrophic cardiomyopathy, it is important to take them to the vet immediately for proper diagnosis and treatment. Diagnosis of hypertrophic cardiomyopathy in cats involves a physical examination of the heart with a stethoscope or ultrasound examination of the heart. Treatment of hypertrophic cardiomyopathy in Abyssinian cats may include the use of medications to control heart rhythm, reduce blood pressure, and improve heart function. Sometimes, surgery may be necessary to reduce blood flow obstruction in the heart. It is important to remember that hypertrophic cardiomyopathy is a serious condition and requires long-term management. Regular monitoring by a veterinarian and maintaining a healthy lifestyle can help slow the progression of the condition and improve the quality of life for your Abyssinian affected by hypertrophic cardiomyopathy. 6. Patellar luxation. Patellar luxation is a condition in which the cat's kneecap, patella, detaches from its normal position within the knee joint. This is a common orthopedic problem that can affect Abyssinian cats, as well as various other cat breeds. In Abyssinian cats, patellar luxation is usually caused by structural abnormalities or muscle imbalances around the knee joint. This condition can be genetic or can occur due to injury or being overweight. Patellar luxation can occur in one or both of a cat's knees. Symptoms of patellar luxation in Abyssinian cats can vary depending on the severity of the condition. Some possible symptoms include: first, limping. The cat may be seen curling or jumping while walking due to pain or discomfort. Second, loss of ability to jump. The cat may avoid jumping or going up and down stairs due to difficulty using the affected knee joint. Third, pulling the paw. Cats may pull the affected paw into their body while walking or running. Fourth, wriggling or licking the knee area. The cat may try to reduce the pain by wriggling or licking the affected knee area. If you suspect that your Abyssinian is suffering from patellar luxation, it is important to take them to the vet for proper diagnosis and treatment. The veterinarian will perform a physical examination and may refer your cat for radiography, X-ray, to evaluate the condition of the knee. Treatment for patellar luxation in Abyssinian cats depends on the severity of the condition. Treatment options may include conservative management with physical therapy, use of pain medication, and weight control. In more severe cases, surgery may be necessary to correct the position of the patella and improve the stability of the knee joint. It is important to follow your veterinarian's advice and instructions for managing patellar luxation in your Abyssinian. With proper care, many cats can live comfortably and actively despite this condition. Give your income in the comments column. Subscribe.